For our project, we decided to do PTSD. A little description of the disorder. PTSD stands for post traumatic stress disorder. It is a psychiatric disorder that may occur in people who have experienced a traumatic event, series of events in just graphic detail. This is very common in first responders and military veterans. Some symptoms of PTSD are being easily startled, feeling tense or on edge all the time, having difficulty concentrating, or falling asleep and staying asleep, easily irritable and having angry or aggressive outbursts, and also engaging in risky behavior. There's a few ways to diagnose this. Most commonly is mental health evaluations and questionnaires. It can also be diagnosed through physical exams at a doctor's office.
All right, interventions for the treatment. Treatment objective, teaching your skills to manage your symptoms, helping you think better about yourself, others, and the world, learning ways to cope if any symptoms arise again, treating other problems often related to traumatic experiences such as depression, anxiety, or misuse of alcohol or drugs. Some psychotherapy options are exposure to therapy, which helps the client safely face situations and memories that may find frightening and triggering. This will help them learn to cope with them. This is beneficial for those with flashbacks and nightmares. Also, cognitive therapy, which is talk therapy that helps the therapist see cognitive patterns and ways of thinking that may trigger these experiences. This is often used along with exposure therapy.
Some other treatment that goes with that was previously mentioned. Cognitive behavioral therapy. Through this, the type of therapy patients get more aware of their thoughts and emotions, understand like what triggers that, and gets known for those. Identity automatic responses or identify automatic responses, detailed statements of the worst traumatic events that has happened to them, thinking about them and how they was, and they can just, like I said, know like what triggers those and kind of help themselves out, read aloud and try to come up with terms of the events. Prolonged exposure therapy, understanding patients' experiences is what the therapist needs to do. Kind of get on the same level with them. Breathing techniques, creating a safe space for the scary and anxiety filled stimuli, um, facing their trauma. Imaginal exposure, patient describes event in detail, having to face the trauma they once had. And exposure, confronting the trauma is assigned as homework. So instead of just working with that in therapy, they actually work on it by themselves and get better with that as they can use it throughout their lives.
So here's some effects of having PTSD. So there's a bunch, but here's just some of the ones that we narrowed it down to. So living with someone with PTSD may be hard, especially if they have children. Individuals with PTSD may be startled easily, so a pan dropping on the ground or a loud noise may bring back past trauma. Communication and trust will be effective when living or being friends with an individual with PTSD. An increase of stress and anxiety within the relationship may occur. It just depends on how they handle that. Hallucinations and intrusive memories may occur. Social isolation also may happen, since certain environments and or triggers may enhance PTSD symptoms. And aggressive and reckless behavior is also noticed in individuals with PTSD.
There's a few outcomes that we covered. The first one would be PTSD and then childhood trauma and its chronic pain after childhood. And then this childhood trauma uh, leads into either new trauma or old trauma that kind of crops back up or changes. And then is the will admit to being very easily irritated as we point or they'll yell at the other parent. And then another thing that parents will oftentimes hide what's going on between their PTSD and the symptoms. Doesn't see the irritation or the stress or what have you. Too long ago, which showed that rent exposure therapy um, um, partly due to the fact that PTSD is highly comorbid with substance abuse. Group delivered rent exposure therapy is feasible and it can significantly sessions.